I see all the time, by the way, is dysregulated blood sugar. Most of you probably heard that high blood sugar is not good. That drives inflammation. We know that. But we don't very often talk about low blood sugar. Neuroinflammation depends on the severity of neuroinflammation. Okay, so if you have mild inflammation, I normally see patients with brain fog, is that I have patients that come and they have, for instance, depression and really symptoms of neuroinflammation. They have been everywhere. They have done all kinds of investigation. We don't know what's wrong with you. It's probably in your head. Live with it. And
classic, right?
Classic,
it's in your head.
Which is very sad. It's so important to ask the question, have you had any brain injury?
If there was just like one message you could tell me, Ari, this is what you really need to do for brain health, what it is. Hi, everyone, and welcome to a new episode of Sano Health. I'm really excited to be back, and today we are going to talk about a very important topic, which is brain health, neuroinflammation. And why is that? Because brain impacts our mood, our hormones, our immune system. You know, if brain is inflamed, our overall health is down. So for this, today I have a great expert in the space to talk about this, and is Dr. Didar Reimer. Didar, welcome to the show. Thanks so much for being here today.
Thank you for having me, Ari.
It's a pleasure, and how nice that, you know, we are here in Porto, right, in the context of this Congress for Integrative Medicine. And of course, you know, when we connected, something that really caught my attention, right, is your journey, because you are a trained doctor since 2006.
That's right.
You train in functional medicine, and you have your own clinic, which is fantastic. I love, you know, women who are CEO, founders, and of course, you treat patients all over the world as well, not only in Sweden, but internationally.
Yes, now I opened more internationally. That's right.
So tell us a little bit about your journey. How do you get into functional medicine?
I mean, to start with, I'm originally from Iran. So, and in the Iranian tradition and culture, we always use food as medicine and also spices. So from a very early age, I could hear my mom when we had some infection or gut issues, she was mentioning food as medicine. And since I was brought up with it, I didn't really think so much about it. And the interesting thing that I cannot help myself to share is that when I started to study medicine, I started to question all these traditions. Because in medical school, everything that is not taught in school is alternative medicine.
Right.
And we don't learn much about nutrition. But my journey in functional medicine really started with my own health journey. It was when my first son was born, and he didn't sleep. He couldn't sleep. So I was up all night. And during the day, he was categorized as this high-need baby. So I need to carry him around. So after 8 months, my body started to signal that it was not feeling well. So I developed exhaustion. And the starting point, I would say, was when I met a colleague of mine for a second opinion, because as a medical doctor, I knew what was going on. It was exhaustion. And during that consultation, he turned to me and said, Didar, I know what's wrong with you. You have a depression, and you need to treat this with antidepressant. And I know that during that meeting, something happened inside of me. And it was my, I would say, intuition, a gut feeling that this doesn't sound right. And of course, I went against my intuition, which you should never do, by the way. And I started to take those antidepressants for 4 weeks only. But again, this deep voice was coming back to me like, this is not right. This is not the right way to go. And so I stopped it. And then I think this is my tradition of, you know, food as medicine. I was like, what about if I start to change my diet? And I started to do some research, and a whole new world opened up to me, which I didn't even know existed. And I found colleagues of mine using food as medicine. And that's where my journey started. I changed my diet, and there was absolutely no turning back after that.
Wow.
Because the result that you see when you address the cause, it's amazing.
Wow. And I love that, turnaround from your own personal experience, right? How you decide to, okay, something is off, antidepressants are not the way to go. And I love that you share this. Thank you, because I'm sure a lot of people listening to us, right, might relate to this. Food as medicine is just such a, it's a hot word, I would say right now, but we need to understand a little bit better. So let's dive a bit deeper on how this food can change our brain health. And the first question I wanted to ask you to kick off is, what is neuroinflammation? What is the inflammation of the brain?
So neuroinflammation is exactly what it sounds like. It's inflammation of the brain and the spinal cord. So the inflammation is normally driven by inflammatory mediators. So this is basically what it is.
So this inflammation, interesting, you mentioned the spinal cord as well, right? What causes it?
So there are many causes. I think in medical settings, what we primarily associate neuroinflammation to is infections and neuroautoimmunity. There we normally, when we are working in the hospital or medical centers, we associate, for instance, infection of the brain like neuroborreliosis or viral infections like viral encephalitis to neuroinflammation, or neuroautoimmunity like MS. I think most of us know MS. As neuroinflammation. But now we know that there are so many other drivers that drive, or causes that drive neuroinflammation. And the medical research is showing now a correlation between systemic inflammation and neuroinflammation. So, and that makes sense.
That makes sense, actually.
Right? Because why would the brain be disconnected from the rest of our body? And so this is one cause. Actually, it's the foundation, I would say. And we know that people that have more systemic inflammation, like patients with ischemic heart condition or diabetes type 2, their prevalence for neuroinflammation is much higher. The other thing that we see, that I see all the time, by the way, at my clinic, is dysregulated blood sugar.
Wow.
So, and what I would like to mention, I think most of you probably heard that high blood sugar is not good. That drives inflammation. We know that. But we don't very often talk about low blood sugar.
Low blood sugar.
And this is actually more of a problem than high blood sugar.
All right. Let's unpack this a little bit, because I find it super interesting, right? Low blood sugar. And so let's dig a little bit deeper as to symptoms, early signs about this systemic inflammation, therefore this neuroinflammation, brain inflammation, considering, high sugar, considering, let us go a bit deeper. What are the early signs, the symptoms?
The neuroinflammation depends on the severity of neuroinflammation. Okay, so if you have mild inflammation, I normally see patients with brain fog. The alertness of the brain is kind of a little bit lowered. The thinking process is lowered. Typical is like, for instance, when they are exposed to chemicals or certain foods, they can develop brain fatigue or brain fog. These are subtle symptoms of mild neuroinflammation. Then we have moderate. This process has been going on, damaging neurons. The neurons are not working properly. And now we start to see depression, fatigue. The patient normally comes and say, I don't know, I don't feel rested. I've been sleeping for 8-9 hours, and I feel like I need to sleep more. Their concentration, memory is affected. Appetite can be, changed, and so on.
And Didar, so do you find in your clients and your patients that when they are in this kind of stage, they make poorer for decisions, right? You were mentioning before that food is such a catalyst, right, of our brain health. Now you're telling me, right, that, foggy head and they have these symptoms, but how this piece relates to food?
I think very often when your brain is inflamed, also it affects the neurotransmitters, like serotonin. Your mood is low. And one way to raise serotonin, we know that, sugar has an effect on serotonin synthesis.
So, sorry to interrupt, but serotonin is the happy hormone, right?
Yes,
if someone is listening to us and is like, what is it?
Yeah.
It's like, can you just give a 30-second?
That's the hormone it's a happy hormone. If you just summarize it easily. Yeah, that's...
Okay, so sugar drives or boosts this happy hormone.
Yes, and that's why many people go on high carb diet, because it makes them temporarily feeling better. This is also we see in women with PMS problem because it also affects serotonin when your hormones is fluctuating. And very often we use carbs to elevate our mood. But it's just temporary, and it's not the correct way of doing it, because this drives actually more neuroinflammation.
Wow. No, it's super interesting because everything is kind of correlated, interconnected.
Yeah.
And we touched a little bit on, the symptoms, the role of the food. Now, let's go a little bit on gut. So is it real, Didar? Is there a gut-brain connection?
Absolutely.
Tell us about it.
And there is so much research now showing that we call it the gut-brain axis. We have known for years that IBS patients have higher tendency to psychiatric conditions, especially depression. But we just said, it's just part of their condition. But now we know that the gut has a fundamental role in our brain health. And those gut bacteria, we can say that they mediate or affect the brain in two different ways. So if you have an overgrowth, an imbalance of bacteria, which we call in medical terminology dysbiosis, this leads to low-grade inflammation in the gut lining. And now the gut lining becomes more permeable because the gut lining is different in a way compared to other linings of other organs, because the cells are very tightly bound together, and they're just supposed to allow nutrients through into the bloodstream. So when you get this permeability, now a lot of other things are starting to leak out to the blood system and activate the immune system. And this process drives a lot of inflammation. And something that I need to mention is LPS.
LPS. What is it?
It's lipopolysaccharides. So this is a protein that is on gram-negative bacteria. And we have that in our guts, So when the gut becomes more permeable, now these LPS are leaking into the system. And if you want to drive the immune system crazy, give it LPS.
You need LPS.
Yes. So this is a direct correlation to neuroinflammation. We know that. The other thing is also when you have a dysbiosis and you have overgrowth of certain bacteria, we know that these bacteria can produce certain metabolites and peptides. These can be either pro-inflammatory or anti-inflammatory. Okay,
wow.
So
this is super interesting, actually. And I will stop you there because, first of all, what foods boost this LPS, right? If LPS is kind of the villain that brings us this inflammation, where we can find this?
So sugars and processed food. And this is, unfortunately, many of us live on this type of food. So that's why changing diet is so important.
In connection with sourcing supplements, hear me out. If you are a practitioner, register on amritanutrition.com to source your supplements, to benefit from commissions, and also to access the basic plan of Sano's practice management system. Now, let's continue with the episode. Definitely, and I'm sorry to think, Didar, that brain health depends on gut health, right? And vice versa. It's super fascinating, right? And you mentioned there's more and more research about this, the gut-brain connection. And before you mentioned the neurotransmitters, can you explain what is it? What is a neurotransmitter? What's the role it has in this gut-brain axis?
Yeah. So, and we have different type of neurotransmitters. Like serotonin is a happy hormone.
Right.
Dopamine is the one that are responsible for our drive and motivation. We have acetylcholine, which is good for our memory. And then we have GABA, which is the only neurotransmitter that has a calming effect on the nervous system. And what else do we have? Noradrenaline. This is also to keep our brain alert. And it's a part of this sympathetic pathways as well.
So all these neurotransmitters, they're like a little army that then they speak to each other. They are kind of working around like, hey, now you're alert. Hey, you're calm. Hey, you gotta react or...
Yes.
So this is exactly it.
And you need to create that environment so these are in balance and work properly. So when you have a condition where, you are stressed by high cortisol that cause inflammation, or you have a dysregulated blood sugar, or gut is not working properly, all these factors play a role on our well-being. The other thing that I would like to mention, because we talked about causes to neuroinflammation, because this is very often missed by the healthcare system. So I would like to mention it. It's brain injury.
Wow, brain injury.
It could be direct brain injury, or either if it's, you hit your head and it's traumatic, or it's vascular. The thing is, what I have seen very often is that I have patients that come and they have, for instance, depression and really symptoms of neuroinflammation. They have been everywhere. They have done all kinds of investigation. And they say, we don't know what's wrong with you. We don't know what's wrong with you. It's probably in your head. Live with it.
Oh.
And
classic, right?
Classic,
it's in
which
your head.
Is very sad. And it's so important to ask the question, have you had any brain injury? Because very often the patient doesn't relate that brain injury, because you can have hit your head 10 years ago, and you had a mild concussion. You don't even remember or think about it. And that have triggered the immune system, the microglial cells of your brain, driving inflammation.
Wow,
and
from 10 years ago.
10 years ago. And now you're starting to show symptoms.
That's crazy.
So it's the question that I always ask my patients, and every patient with neuroinflammation, basically. And I caught quite few with post-traumatic brain injury.
Didar, so this is very interesting topics. I'm just shocked about what you just told us, right? This 10-year delay can happen, right, from brain injury. And I wanted to ask you next about dementia, cognitive decline. I mean, unfortunately, right, a lot of people, we have a closer loved one who is struggling with that. Do you see also that in clinic? And I don't know if there's any research or food dementia relation that we could refer to.
We have an epidemic right now of Alzheimer's disease and dementia. And a few percentage are related to our genes, okay? Because we can have some genetic composition for it. But most of it is related to our lifestyle. And when you have a neurodegeneration, it's actually a sign of severe neuroinflammation. I told you that there is different levels.
Yeah.
So yes, it is common, and I meet them. And it's really important to, when you caught a patient with dementia, it depends, of course, how far. But you can actually make a huge difference in the progression of the disease. And sometimes you can reverse it even.
Wow.
Yeah.
Well, we are going to talk about this. I cannot wait to get, into the details, into actionable insights as to which foods could and can help us prevent this dementia. But, we are getting closer to one of my favorite sections of the podcast, which is a true-false fireside chat. So stay with us because this is going to be very spicy. I cannot wait. But one last question, Didar, is that a few requests came from the audience to talk a little bit more about hormones in women and men and their relation to brain health over time. So let's say a woman going through perimenopause, entering menopause, the foggy head that we hear about. Does this relate to neuroinflammation? Can that happen?
Yes, it can. We know that hormones, because we need to also talk about the basics, right? Because for our neurons to feel well and for the neurotransmitters to be produced, we need building blocks. Okay, so it's vitamin, minerals, amino acids, and a good environment, as we talked about. But also hormones play a really important role in neurotransmitter synthesis. So, for instance, in women, we primarily talk about estrogen, progesterone, and also testosterone, actually. We don't have as much testosterone as men, but we do have that.
And that plays a role, right?
And estrogen is the master regulator of basically all our neurotransmitters that we talked about before.
So what happens when we go through an estrogen decline? How our brain responds to that?
Of course, you need these hormones to produce neurotransmitters. So when they drop, and in combination, very often also we have other issues like that we talked about that drives neuroinflammation. And now you start to, because it affects, like estrogen affects serotonin, dopamine, acetylcholine, a little bit GABA as well, and noradrenaline. So no wonder that women start to feel depressed, developing anxiety, sleep issues, memory issues, all this related to the drop of estrogen. And then we have also a drop of progesterone. So actually the first hormone that drops in perimenopause is progesterone, and then estrogen. Yeah.
Wow, this is so interesting.
And progesterone is it's important for GABA. And GABA, as we mentioned, is the calm
Zen one.
neurotransmitter.
So if we lose that one.
Yeah, so that's why we must say, I don't understand. I never had a panic attack in my whole life. And suddenly I just developed anxiety and I'm so anxious all the time. I don't understand what happened.
I think, Didar, one of the key messages here is that for any women listening to us, it's not in your head. It's part of, this chemical process, this hormonal process. And I'm glad that you could tell us about that. But let's switch now to the true and false fireside, because I think this is going to be super interesting. And as you know, right, true, false, we have 3 statements. And the first one, Didar, is, can food alter your mood and brain function as powerfully as a drug?
Of course.
Wow.
I don't know of any drug that can, not what I've come across actually. I mean, we have anti-inflammatory drugs that we can use, which has a temporary effect, but it doesn't address the cause. So food is an extremely potent tool that we can use to reduce inflammation, to improve our brain health. So yes, absolutely.
Wow. Yeah, the power of food. Food as medicine, food for brain health.
Yes.
Amazing. The second one is depression and anxiety are just chemical imbalances you have no control over. True or false?
This is unfortunately what the healthcare system tried to tell many people, patients that come with their severe depression or anxiety, and it's very sad. I would say, of course, chemical imbalances can be a cause, right? But why do we have these chemical imbalances to start with? We need to ask that question. And the chemical imbalances are very often rooted in neuroinflammation and the different factors that we were talking about. So when you address the cause, you actually heal yourself from depression, anxiety, psychiatric condition. And I can't stop myself to sharing this story because it affected me so much. I had a 19-year-old young man who had been depressed since age of 8.
Wow.
It has been affected his life, all his life. And he was put on antidepressants from age of 8. Can you imagine that early?
What?
And he had a hard time to finish his school. And when he was 19, he was in a very bad state. He was really severely depressed. And they said, okay, let's try, because we have tried all these SRIs, antidepressants, nothing is working. Let's try the functional medicine approach. Within 6 weeks, this patient who came into my office didn't have an eye contact, had lost all hope. Within 8 weeks of changing diet and with right supplementation, he came in as a new person with a big smile on his face, and he had got his first job ever.
Wow,
and
incredible.
That's within 6 weeks. I don't know of any drug that can have that result.
Wow, you just made my day. Telling me this story is just amazing to hear that. But let's go to the final true or false statement, which is, if you're inflamed, you're stressed, you don't sleep, do not worry. A supplement stack will fix that for you. True or false?
Very false indeed.
I knew you would say that.
Because if we use that of just supplementation, what difference is it between medication, really? Of course, supplementation doesn't have side effects to the same extent, but you don't treat the cause.
So we go back to the root cause. And I love that you keep mentioning, right, that, because functional medicine, right, is all about finding, digging deeper, investigating. So, yeah.
Because we don't work with diagnosis. I normally tell my patients, I don't care what you have. Honestly, I want to understand the mechanisms. What are the mechanisms that drive the symptom? And the mechanisms can be so different. So you can have 5 severe depressed patients, the causes are different.
Yeah.
So individualized medicine is important.
Personalized medicine, yes. And I love that. So Didar, we're getting into kind of the last block of the episode. And in this blog, we're going to get a little bit more actionable, right? We know now what is neuroinflammation. You explained to us all the symptoms, possible causes. The food as medicine statement is so powerful. But now let's get deeper. Like, what are the top foods that everyone should know about to take care of their brain health?
Well, basically go back to the basics, which is natural food. Everything that Mother Earth has created for us are good for us. And leave the processed food. Greens, vegetables, fruits, good meat, beans for those who tolerate it, lentils, all these foods are health food, and that will boost your brain. Healthy fats, avocados, coconuts, nuts and seeds.
And what are maybe little steps, let's say, to start adding, let's say, this coconut seeds, this avocado into our diet, right? If we are not used to that, what are the little tips that you would suggest starting with?
Sometimes, lifestyles you mentioned, it can be really hard if you lead a certain lifestyle. So small changes that you can do is, like, for instance, adding more berries into your food, more vegetables, more colorful.
The rainbow. We want to see that rainbow.
The range of, rainbow foods.
Okay.
Yes.
And tell us a little bit more about the role of exercise, for example, in brain health. I think this is such an underestimated, area and topic. Any insights there, Didar?
Ooh, that's one of the pillars. I normally talk about 3 pillars, or actually 4. So one is sleep, blood sugar regulation, exercise. We know that exercise has a tremendous effect on our brain health because it releases something we call BDNF, brain-derived neurotrophic factor. Is a growth factor that improves the connection of the neurons in the brain. And especially, we have seen that exercise, especially aerobic exercise, high-intensity exercise, increases the neuroplasticity in hippocampus. That's where the center of our memory. So it's been also showing that it's been very effective to treat dementia.
Wow.
For instance, yeah.
Super interesting. Amazing. Well, I also wanted to ask you about supplements. I know that, of course, it's all about the food. As you said, it's all about going back to the basics, this whole grain, this not processed fruits, vegetables, a rainbow.
Yes.
But what happens when we look into what's out there in terms of supplement stack? And specifically, Didar, my question is about probiotics. Like, I'm very excited to see in the market that more and more, there seems to be some strains targeted at brain health. What's your take on that?
I think probiotics can be helpful because it has an anti-inflammatory effect on the gut and also sometimes on the brain. But I work more with prebiotic.
Right. So prebiotic is the like what feeds the bacteria. Just if someone is listening to us and is like wondering what is the difference, probiotic will be the bacteria itself, and so you focus on the prebiotic side, which is what feeds that bacteria.
Yes, more than the probiotics, because I think the probiotics have a temporary effect when you use it, and it can be helpful, but you need to strengthen the immune system in the gut. And the way that you do it is to strengthen the microbiome. And how do you feed the microbiome? Well, it's through fiber.
Prebiotic.
Yes. And also I'm a big fan of short chain fatty acids because they have shown that it actually have a very, it supports intestinal barrier, but it can also have a positive effect on the brain barrier.
Wow.
So yeah, I focus more on prebiotics and short chain fatty acids and sometimes on probiotics.
And which foods are good prebiotics for the brain?
So prebiotics, well, everything that contains fiber, basically. So vegetables, again, all the plant-based foods contains good amount of fiber. So when you start increasing the amount of plant-based food, then you feed these good bacteria.
So we go back right to the circle of gut-brain connection. The axis is real. Such an incredible space. And I'm so amazed, Didar, the cases you share with us, right? This 80-year-old with depression until 19-year-old, completely new person. So it's real. Food as a medicine is real. And I wanted now, as we are wrapping out this episode, that you leave us with what is, if everything had to go down to one message, if there was just like one message you could tell me, Ari, this is what you really need to do for brain health, what it is.
Or if I really need to pick, I mean, it's a hard one because, you have to have a holistic view on health, right?
I know, but
number
comes down
one,
to one.
Exercise.
Exercise. Above food.
Yes. I would say that.
Wow.
Because it improves the neuroplasticity of the brain.
Wow.
And it's a hard one, right? Because you put me in a difficult spot. Of course, the food is, of course, important. Of course, it's a foundation. But no, if I have to pick, then it would be exercise.
No, and I really appreciate you mentioned that because, I need to do more workouts anyway, but I think there's not enough education around that, right? Like how exercise and brain health are so connected. So I love that.
And if you want to go a little bit deeper, our emotional state is extremely important for our brain health as well.
The emotional state.
Yes, trauma, stress and emotion, that's all, and that's another podcast, I guess.
Oh yeah, part 2. Well, I'm sure there will be a lot of questions. And Didar, it's been amazing. How can the audience and anyone find you online?
They can find me on my website through healthclinic.se, or on Instagram and Facebook.
Okay, super. Didar, it's been an honor. Thank you so much.
Thank you so much, Ari, having me. Thank you.
Well, I hope that for all of you, you have learned as much as I have done. Now you have no excuses. Go to the gym, figure out your workout routine. We now know that exercise is such a key factor driving brain health and improving this neuroinflammation, but also food. We learned food as medicine is completely, the way to go. Picture and find that rainbow, as Didar told us. And do not miss our next episode coming up real soon. I want to see all your questions about this one. And thank you so much for staying. See you soon.